All right, I think we're live. Good morning, everybody. I hope you're well. Today, I'm gonna be live on YouTube for an hour and I will be answering any questions you have for anyone who joins on exercise, nutrition, and lifestyle changes during cancer to not only manage the side effects of the cancer treatments and the medications that you have to go through during your cancer journey, but also how to use exercise to and nutrition to actually reduce the growth and fight cancer. So I'll be here. I'm actually working on a guide for nutrition strategies and foods to combat urinary incontinence, especially the one that manifests after prostate cancer surgery, so prostatectomy. But while I'm here, I will be checking the chat. I will be seeing if anyone joins, and I'll be here to answer your questions. Feel free to say good morning whenever you want. It's actually 7 a.m. here in Perth, Australia. I would love to hear where you are from and what time is at your place, how's the weather, and what is your journey. If you have cancer, if you have prostate cancer, what is your journey? If you want to share anything with us. I would also like to give a bit of an introduction about myself. I have a PhD in exercise science, and after I finished my PhD, I did postdocs, which is research on exercise against cancer. And I've worked with a lot of men with prostate cancer, and we used exercise to counteract the side effects of androgen deprivation therapy. You might know it as testosterone suppression or hormone therapy or Lupron, which is one of the most popular brands. And I used targeted exercise on how to reduce the side effects of that, both the physical and the mental side effects. Now, in the lab that we have been in the institute that I was working in, um, it is actually a prostate cancer survivorship institute, so specializing on exercise for prostate cancer. And we have been using exercise on men with prostate cancer that are about to undergo radiation therapy. And a lot of what we do is use exercise immediately before radiation therapy to actually enhance the effectiveness of radiation therapy. So not only using exercise, to reduce the side effects of the treatments and fight cancer, but we actually use exercise immediately before. So they were on the bike exercising immediately before they went to do the radiation therapy. And we have seen that actually that increases the blood perfusion, so how much blood is going into the tumor, and delivers more of the dose of radiation to the tumor. So pretty advanced stuff, pretty exciting stuff, and I think in the next 5 to 10 years we'll be looking at how to using exercise alongside any treatments for prostate cancer, such as chemo, radiotherapy, ADT, all that to actually enhance their effectiveness. But for now, in today's stream, as I said, I am working on a guide on how to use foods and nutrition strategies and hydration to reduce incontinence from prostate cancer surgery. And I will be hopefully publishing this guide in the next few weeks. I'm keen to watch what you want to share with us today and read your comments and say hello. I'm wondering, does any of the viewer is suffering from any incontinence, any bladder issues, or any leaking? Uh, it doesn't have to be after prostate cancer surgery, but I'm just curious to know if you are currently experiencing that, and if you would like to share with us anything and maybe ask anything. Hello, Matthias. Um, Good morning. It's 7 a.m. here in Perth. I think in Portugal it must be quite late, right? Must be like midnight. Um, Thanks for sharing that with us. Have you been tracking your PSA through multiple years, or was this your first test? Now, that is a bit of a higher value for PSA, and even though I've said in previous videos that there's no specific norm for PSA, so you can't say, for example, after over this value PSA, that means you have something in your prostate or you have prostate cancer, whereas below this level, you're fine. There are many men with very low PSA levels, less than 4, that have prostate cancer, and there are men with over 8 that do not have. Okay. However, it could mean that you have some inflammation there, something going on. So it would be advisable to just monitor that and just talk with a medical professional, just work with them, either a general practitioner or a urologist, just to make sure you track that and see why that is happening. Many men with high PSA don't have prostate cancer. They have something called benign prostate hyperplasia, which is basically increase in the size of prostate, and that is benign, so it's not a malignant cancer, so not like a tumor, a bad tumor. But you need to monitor that from now on. Just do regular PSA tests according to what your medical professional will tell you to do. Maybe some people, some medical professionals want every 1 year, others want every 6 months. Just work with them closely and monitor that. However, I would recommend that you keep exercising, and I would be interested to hear if you do any exercise at the moment. And there are also many foods, and you can change your diet. And I guess you're from Portugal, you might have a bit of a Mediterranean diet already, which is great. So yeah, just high PSA means inflammation there. So managing inflammation is really important. Also wanted to mention, especially because I'm writing this guide on reducing urinary incontinence after prostate surgery, using food, and how to use nutrition basically to reduce incontinence. It's very important if you, just like Matthias, for example, if you know that there might be something wrong, and down the track you might consider having like a prostate surgery, it's super important to prepare for it. And how do you prepare for it? Well, there are specific exercises that you can do, pelvic floor exercises, you might know them as Kegel exercises, that actually strengthen the pelvic floor muscles. So what happens during a prostate surgery, and I'm not saying that any one of you will have, but just so you know, what happens during prostate surgery is that basically the prostate is taken out, okay, or a big part of it. Now, the bladder sits on top of the prostate, and the urinary tract goes through the prostate. So when you remove prostate, because prostate was supporting the bladder, there is suddenly nothing to support that tissue, and now the pelvic floor muscles have to do this work. But for us men, women are more aware of the bladder muscles. For us men, we're not that aware of our bladder muscles. We don't use them that much, our pelvic floor muscles. So suddenly, we are relying on muscles that are not trained. So we have to train them before we go and do prostate surgery. And apart from pelvic floor exercises, we also need to build an aerobic capacity for the tissue. So doing some walking, some brisk walking, nothing too crazy, and just doing some strength exercises for that area. Okay. So don't wait to have the surgery and then try to manage the symptoms. You still can, but it's much better to prepare for it. Good morning. I hope you are well. Good to hear that you had a biopsy and it didn't show any prostate cancer. What I would, and that's good, like PSA could be high, even or higher than 4, than that arbitrary line 4 is, and without, you don't have prostate cancer. And generally, as we age, all men, our prostate grows. Okay, so it's natural. It's natural. And because we have a bigger prostate, our PSA levels will tend to go higher during as we age. The problem is when some of those cells might become malignant. Okay, you might have like inflamed prostate, like BPH, benign prostate hyperplasia, no prostate cancer, that's fine. But yeah, it's just monitoring to see if PSA changes bit faster than it has over in the previous years. However, I would recommend for the viewers in the future, try to see if you can get an MRI instead of a biopsy. Why? So when we do a biopsy, so imagine this is your prostate, we basically sample, most oncologists or surgical oncologists take 12 parts, like 12 biopsies. So they take 12 regions around your prostate. That doesn't mean you get the whole prostate. Okay, you get 12 regions around the prostate, which is good in most cases. And prostate cancer is a cancer that increases slow. It's a very slow cancer. So even if you don't get it the first time, if it's small and grows bigger, it's still quite manageable, especially with the new therapies that are being developed today. And I can talk about them in a future live stream. So we have like some amazing therapies that are coming out for prostate cancer. I have personally worked with in clinical trials, and I have seen men full with metastatic prostate cancer in their skeleton after 2 injections with a therapy called lutetium. You might know it as PSMA or theranostics. So with 2 injections of that, cleared out. So completely, it was basically spread everywhere. Now that doesn't mean that's gonna be you, and these men were living with a particularly aggressive form of prostate cancer for many, many years, okay? So prostate cancer is a very, very, very slow cancer. Again, high PSA does not mean prostate cancer, all right? Just to put your mind at ease for you watching this. But in general, I would recommend in the future, if you're going to see any high increase in PSA and you're a bit alarmed, you just want to check what's there, you know, MRI is better than a biopsy. Now, I'm not gonna say that, you know, some oncologists prefer to do a biopsy. This is what they have been used to. Now, I don't want to say that, but in many cases, there's a bit of a financial incentive for them to recommend you to do a biopsy, you know. But I think the majority of the medical community now have started moving away from biopsies and doing an MRI, because with an MRI we can see the whole prostate instead of just sampling 12 times. And also it's non-invasive, so you don't, biopsy is basically a microsurgery, okay? So I just wanted to say that for all the viewers. But yeah, thank you for sharing that, and I'm very glad to see that after your biopsy, there was no malignancy detected. Good morning, Pietrix. I hope you're well. Now, Pietrix asked, does exercise increase your testosterone? Do you still think it's good to exercise? I mean, lifting weights. Exercise does increase testosterone for up to 24 hours after the exercise, and especially exercises that stimulate the muscle tissue, okay? It is not, I'm gonna give you the answer, the short answer straight away, and then I'm gonna explain in more detail. If you are afraid, or if you're concerned that if I exercise, I'm gonna increase my testosterone, and therefore that's gonna increase the rate of the prostate cancer growing, or increase my risk of getting prostate cancer, do not worry, for multiple reasons. So yeah, the answer is that exercise as much as you want. Don't worry that exercise increases testosterone, therefore it's gonna give me prostate cancer because of more testosterone, or if I do have prostate cancer, it's gonna make it grow faster. Not at all. Actually, the opposite happens. So what happens, and this is gonna be a bit of a big, big explanation now after giving you the short answer. And actually, that's a good idea. Thank you for asking that question, because I might note it down for a future video, just to make video, because I guess more people will have this question. Sec, let me write this down. Multiple reasons why it's not a problem. First of all, when we exercise, we do have an increase in testosterone in the body. First of all, if you're taking ADT, all right, and I'm just gonna call it ADT, you might know it as hormone therapy, the minor increase from testosterone, of testosterone from exercise is not ADT, hormone therapy, ADT, Lupron, okay, all that is really powerful. So it really suppresses down your testosterone. So no matter how much exercise you do, you cannot overcome the testosterone suppression from hormone therapy. Okay, I just wanted to say that first of all. Secondly, testosterone that is released, let's say you're not getting hormone therapy and you just want to make sure that you're not going to increase the rate of growth of prostate cancer from exercise. When we exercise and our body releases testosterone, now usually most men with prostate cancer will be over 60, most will be in their 70s, okay? The release of testosterone is less during that age, but still we do have a release of testosterone. The muscle takes up a lot of that circulating testosterone. So when we exercise, we stimulate our muscle tissue, okay? Especially the leg muscles, which are big, but the upper body muscles, especially in men, have a lot of androgen receptors. What does that mean? That means that there is a lot of places for testosterone to bind, okay? So when we exercise, these receptors in our muscles open up, and any circulating testosterone is actually being taken by the muscle. It connects to the muscle tissue. So it's not only so basically the testosterone that is circulating is sucked up, it's taken up by the muscle, okay? Thirdly, when we exercise, we actually create an anti-tumor environment in the body. What does that mean? Basically, as it sounds, exercise, when you do it, and for a few, about 30 to 60 minutes after you finish, it actually reduces the growth of cancer. And that's what we have been seeing here in our institute. The exercise creates an environment in the body that fights the cancer. How does it do that? Well, it suppresses inflammation or controls it, and the muscle itself releases some molecules. And just for you, just if you are wondering what the name of this is, myokines and microDNAs, okay? These molecules travel throughout the body and are not good for the cancer. They fight the cancer, okay? So we have actually seen that the more of these molecules we have in our blood which are released from exercise, the more it reduces the rate of prostate cancer in cell lines. Okay, so basically they took cell lines of prostate cancer in men at rest. They applied the blood on the prostate cancer cells and the cancer cells grew, okay? But then they had the same men exercise and took the blood 30 minutes after the exercise. And when they applied the blood of exercise on those prostate cancer cell lines, the reduction, the rate of growth of these prostate cells was reduced by 30%. So exercise does something. It releases those molecules that actually reduce the prostate cancer growth. So actually, do not worry that exercise will increase the growth of prostate cancer. It will do the exact opposite. It will reduce the growth of prostate cancer. Okay? I wanted to say I was in a conference, a medical oncology conference, a couple of weeks ago in Melbourne, and I saw a super interesting study in men with prostate cancer. So they found, again, those molecules that are released from exercise are called myokines, and they found that the more muscle mass you have, okay, so the bigger are your muscles, the more of these molecules you release after exercise. So yes, whatever your body looks like, when you exercise, especially a bit of a higher intensity exercise. I don't mean like going for a marathon, okay? So it would be a bit of a higher exercise, high intensity for you. So maybe a brisk walk, okay? Something just to get your heart rate up. So doing that you can start with 5 minutes, but doing even 20 to 30 minutes, which is the best, just to make sure your heart rate is a bit up, you're actually working. Could be in a brisk walk outside. Now, you are gonna be releasing those molecules in the bloodstream, all right? Of course, exercise has multiple benefits. It produces serotonin and dopamine in the brain, which is, the natural feel-good molecules, so you already feel good. It helps you control your body fats. It builds your cardiovascular system, which we really, really need to do. But again, actually the stream has died a bit. One sec. Sorry about that. All right, we're back. So apart from those benefits of exercise, you release those molecules that fight prostate cancer. You will get that however your body looks like, but the more muscle you have, the more of these you're gonna be releasing. So that's another case for men with prostate cancer, or those who are suffering from or have benign prostate hyperplasia, so a bit of an enlarged prostate, okay? It is a super important point to actually do some resistance exercise, so some weightlifting. Again, it doesn't have to be 100 kilos. You can just start with 2-kilo dumbbells. If you do something more than you already do, it's gonna improve you. So for some people it might be 100 kilos, for others it might be 2 kilos. All right, if you start doing those types of exercise, or resistance exercise, getting our muscles safely to just fatigue and feel bad, that builds the muscles. The more muscle you have, the more of these molecules you will be releasing in your bloodstream when you are doing a bit of a brisk walk, when you get your heart rate up. Yeah. So muscle is not just to look good, it's not to be strong and, which are great things to have. It's more of it's like a treasure. It's more of like a active tissue that serves as a reservoir, as a repository, as a resource for those molecules that when we stimulate that tissue, it it actually releases those molecules that fight cancer, control inflammation, and gives us millions of health benefits. All right, so that's my long answer. Thanks for asking the question. I'll make a video on it. Currently 7:30 here in Perth, Australia, and I think it's gonna be a beautiful day today. We currently have summer, and yeah, it starts to get hot. Does any of the viewer have any incontinence? So any inability to control urine? Do you have any issues with your bladder? Any leakage? Any excessive nighttime urination? The reason I'm asking is um, the reason I'm asking that is because I'm actually writing now a guide on exercise, oh sorry, on nutrition, using foods and nutrition strategies to reduce incontinence and bladder issues, especially after prostate cancer surgery. So if you have any issues with incontinence, urinary incontinence, bladder, nighttime urination, any leakage, please feel free to share your experience with us. It's a safe space. And I would be very interested to hear what you are doing already or what have you been told to do. And hopefully, yeah, I'll get this guide on how to use foods and nutrition and hydration and how to best strategize, maybe a bit of fasting as well. I'm gonna talk about that in the guide. I'll hopefully get this guide out in the next couple of weeks for you guys. Good morning, Herman Irish. Thank you for sharing that. So you're saying that your PSA is 5.1 after biopsy with cancer trace, no on active surveillance at present, which is good. So this is, I'm gonna just quickly talk about that. A lot of oncologists have been talking about excessive PSA testing or biopsies. Again, I talked earlier in the session that the medical community is moving away from biopsies and they're starting to do more like MRI scans, which are non-invasive and actually can see the whole prostate, not samples of it. Okay, so a lot of people have been talking about too much monitoring. Monitoring is never too much. Okay, well, PSA should not be done like every week, but what they have been talking about is excessive treatment. So and very aggressive treatment. So a lot of in the past, especially a lot of men, as soon as they got a bit of a higher PSA, they did a prostate biopsy and they maybe found a few traces of prostate cancer. They were slammed immediately with hormone therapy, chemo, like old stuff, like going thermonuclear. Okay, um, and that's too much. Okay, again, if you have prostate cancer is a cancer that grows, thankfully, it's a cancer that grows very slowly. Most cases. There are some cases that are very rare cases that are a bit more aggressive, but most cases, if you have prostate cancer, it's gonna grow very slowly. That's why active surveillance is, if your doctor is on board with it, and if they're a bit more informed, you know, and keeping up with the times, active surveillance is fine. And it might not change for years, okay, or decades. The cancer might not change at all. So that's good. That's good. And you have to weigh in what the benefits versus the drawbacks of any decision you make. So when you, of course, you listen to your medical professional first and foremost. They're the experts. They know. They're working with you. They know your case. You are always welcome, and actually I would recommend getting a second opinion, okay? But I would say taking things slow, being informed, doing your own research is good. Listen to your doctor, listen maybe to a second doctor as well, get a second opinion. Just also research, don't go blind. Understand what is active surveillance. Okay, we're keeping a close eye on the PSA. We're maybe doing a bit of a MRI scans. Again, I would recommend MRI over biopsies, but of course, yeah, listen to your medical professional. And then before you start any treatment, any radiation therapy, any hormone therapy, anything like that, read, understand, and ask. Go and ask. Do not be afraid. Keep asking questions to your medical professional, even if you feel like you are annoying them, you know, burdening them or taking their time. Yeah, so definitely do that. Great to hear that you are on active surveillance and just keeping it slow. Thank you for sharing that, Herman. Good morning, William. I hope you're well. I was talking about that earlier. I just a bit of a quick recap for those who've joined. So we had someone ask before if exercise increases testosterone, and if yes, does that make prostate cancer worse? Because testosterone increases the rate of growth of prostate cells, including prostate cancer. Okay, that's why hormone therapy, which is testosterone suppression, exists. So I was talking about the benefits and how actually exercise that increases your heart rate and stimulates your tissue at the same time. So maybe a bit of a brisk walk, okay, for a few minutes. Cycling stimulates a lot of the muscle tissue, okay, legs. I in many of the men that I work with, and actually, sorry to forgot your question, Herman. You asked about contact information. I have that in the description of the video. So my website is exerciseelixir.com if you wanted to contact me. So a lot of the men that I work with, I prescribe to them some kind of aerobic exercise, some kind of resistance exercise specific to their lifestyle, specific to their treatments, and also some specialized exercise to manage the side effects and also make it more enjoyable for them. So, for example, with a lot of the men that I work with that have excessive nighttime urination, excessive incontinence, anything like that, leakage, we do some specialized Kegel exercises, okay, some yoga as well. But what I wanted to say is that I usually, if they have access to aerobic machines that stimulate the whole body, especially the elliptical machine, that I recommend because it takes up also the upper body. So the more of your muscle gets used, the more of the molecules from the muscle are released. And I was basically, if you go earlier in the live stream, I was talking that these molecules, I can provide the research that shows that actually create an anti-tumor environment in the body. They fight the cancer, basically. Okay. Yeah. but but you do that with exercise that increases your heart rate, so typically aerobic exercise or some kind of circuit training. But the more muscle you have in your body, the more of these molecules are released. And I was talking to the viewers beforehand on the importance of doing resistance exercises, so lifting weight. Again, it doesn't have to mean you lift 100 kilos, you might lift 2 kilos, okay? Just doing more than you're already doing will make your muscle grow if you know how to do it safely, if you know how to program it. And again, this is something I can help you with. You can find my website. The more muscle you have, the more of these molecules are going to be released in the body. Of course, lifting weights has millions of other benefits. All right, so it makes you stronger, it makes you more able, it just by getting your muscles bigger, you burn more calories at rest, and it makes your appetite better. It controls your, if you have diabetes or hypertension, weights are lifting weights is fantastic for you. Okay, it's gonna improve your glucose control and your blood pressure measurement. Apart from that, you also fight cancer much more effectively if you have more muscle. Okay. Um, that's a food that I have included in my guide and why they are useful for incontinence along the other foods. I have a quite extensive list of 20 foods that you should eat and why if you suffer, if you have incontinence. Okay. Good job, Herman, to see that you are doing 16-hour fasting daily. What I would recommend with fasting, and I'm planning to do a future guide on how to fast if you have different symptoms or side effects from prostate cancer treatments, and also just to fight the cancer. Does fasting actually fight cancer? What I would recommend, 16 hours fasting daily is a good having an 8-hour feeding window. But just with everything, if you do the same over a long period of time, your body gets like used to it, so it's not that novel for it. So we do have to maybe give our body new stimulus every now and then. Okay? Same with food, same with exercise. We cannot just keep doing the same thing and expect our body to respond. What we want to do is just give our body different stimuli, different things, all right? Different nutrition strategies, different exercises. Just mix things up in a healthy way to keep our body responding. So if you do 16-hour fasts daily for years, your body's just getting used to that. That's the way you eat. No, what you get benefit from is when you do something new. Okay, so that's when your body really gets this novelty, this signal, and starts to adapt. So what I would recommend is, yes, that's good for you, that works for you, you found a way that you eat very well. Mix it up now and then. Sometimes do a normal fast eating window. You have like a, I don't know, 12-hour eating window, okay, instead of 8 hours. Sometimes go shorter, go a bit of a 6 hour or maybe even 4 hours eating window, okay, now and then. And for those of you that it is safe, of course, all that, just check in, especially if you have any other um, underlying conditions like anything with glucose control or hypertension. Do quickly check up with your GP if it's safe. I would say if it's safe. I mean, if you're doing 8-hour windows, like doing 6 hours windows, it's not a dramatic change. You can give it a bit of a try. But all that, yes, just make sure that you do check in with your medical professional. However, if it's safe for you to do so, mix it up, have a normal day uh, of eating. Sometimes have a bit of a shorter feeding window, 6 hours or 4 hours. And for those of you who haven't tried a full fast, like only water, okay, there are some things that you should take during a prolonged fast, like a bit of a Himalayan salt, but all that again is coming into a guide that I'm gonna write in the future and maybe a video. Yeah, if you do try a prolonged fast, which is fantastic for health, okay, that's how our bodies were used to. We needed prolonged fasts. We needed periods of not eating nothing because our bodies were expecting that. We didn't have food in the fridge uh, 50,000 years ago, all right? Maybe many times we spent days without food, and our bodies knew that this is coming, and they were already had mechanisms inside them, and we do still have those mechanisms to repair our DNA and repair our cell damage during these periods. We don't give a break to our bodies anymore. We just keep feeding every day, every day. So these a bit of a prolonged fast, maybe 24 hours, 48 hours of fasting, okay? 70, I've personally done up to 5 days of fasting. That's extreme, I know. But if you haven't tried yet and you're thinking of doing prolonged fasting, what I would recommend, do not start with a longer fast. Start with a shorter time window, okay? Just like Herman here is doing, 8 hours feeding window. Once you get used to that, maybe you can try 24 hours fasting. But again, it's better to read up a bit before you do that to make sure you do it safely and you don't suffer. All right. Of course, all that if you have no underlying medical conditions which might make this a bit more dangerous. And if you wanted my advice, my personal advice, I can go through your medical history and offer and tell you what fasting, what nutrition, what exercise is best for you. You can go to my website in the description of the video, exerciseelixir.com, send me a message, and I can review your case. All right, I will be signing off in the next 9 minutes. Thus, in this stream, I talked about the importance of exercise, resistance, aerobic, how testosterone released from exercise is not dangerous. Actually, exercise fights cancer, and I explained how. And I invited anyone with any urinary issues, incontinence, bladder issues, or leakage to share their experience, share their point of view, anything they want to say, because I'm in the process of writing a guide on how to use foods, nutrition strategies, and hydration to reduce incontinence, especially the one after prostate cancer surgery, okay? Prostatectomy. So feel free to share your experience. Yeah. I was hoping to do some writing during this stream, but you guys started asking me questions, which is good. Thank you for that. I would like to hear. I talked about lifting weights. I would like to hear if anyone is doing any form of resistance exercise. Do you do anything? Do you lift any weights? Do you have any dumbbells, any barbells, any kettlebells? Do you have any resistance tubes or anything that you do, or any body weight squats, for example? Would you like to share what you do with us, or do you have any questions or just concerns on how to start? You want to do something to build a bit of your strength, a bit of your muscle, just to feel more strong and also get the benefits of fighting cancer, as I mentioned before. Do you have any questions that you would like to ask, and how to start with that? Now is your chance. And a lot of the men that I worked with uh, did not think that muscle or just doing resistance exercise, lifting weights, strength training is really important. A lot of them thought that, oh, well, I don't need to look good. I don't need to look muscular. I'm okay. I've got a wife. I've got kids, grandkids. No problem with that. Um, it's a bit more. Yeah, I had to educate them on how important it is to have muscle, to be strong, to reduce your any problems with diabetes, high glucose in the blood that you have, hypertension with weight, and also had to educate them that look, if you have more muscle and then you do some kind of aerobic exercise that gets your heart rate up, brisk walking, elliptical, cycling, all that, rowing, that actually releases more molecules that fight the cancer. So when I told them that, that's when they started doing resistance exercise. Good morning, Jim. Jim says, I'm on hormone therapy. I got diagnosed for prostate cancer in 2009, and here it is going to be 2024, and my PSA is around 2.1, 2.4. Fantastic to hear that, Jim. Well done. And that's actually, thank you for sharing that. That's great to hear for the viewers that, uh, it is not the end. All right. If you have a lot of, I've worked with a lot of men. I know a lot of men that live happily. They live active lives. They play with their kids, their grandkids for decades. There's no Science has progressed so much that, yeah, it's unfortunately more and more men prostate cancer for multiple reasons. I'll talk about why prostate cancer is on the rise. Unfortunately, more men get prostate cancer nowadays, but science has progressed so much that the therapies are getting better and better at fighting prostate cancer with less side effects. So, yeah, it's no problem if you got diagnosed or you are concerned you might have. You can still, uh, yeah, it's all today. It's almost like you are not. Yeah, that's something that you won't have to worry about. Science has progressed so far. We understand prostate cancer so good now. As I said in the beginning of the stream, because I was working in clinical trials that are coming out for prostate cancer, I have seen men with very aggressive, very advanced cases. Okay, that doesn't mean that's gonna be you, but there are some very rare cases that are really aggressive and they do a metastasis. So the metastasize usually in the skeleton, so the bones, and that I've seen that, spread out. 2 injections of this new therapy. It's some sort of brachytherapy. So basically, they have a protein that connects to prostate PSA receptors, and they label that. They added radiation on that, so they injected that twice. That means that the radiation only goes to the cells that have PSA receptors, which is the prostate cells. So it only selectively kills the cells of the prostate cancer cells, leaving all of your other healthy cells not, so you pee it out basically. They don't touch you. Uh, just 2 injections of that completely clear it out of prostate cancer. So that doesn't mean that's gonna be you. That doesn't mean that's again super rare cases, okay, and very advanced. But most men today live decades of healthy, happy lives. All right. Thank you for visiting my website, William. If you have any questions, if you have any, if you want to work together or do any, yeah, just send me a message, say hello. I can read your case and advise further. Thank you, Herman. You used to do a lot of body weight exercise, but never got to use your dumbbells in years. You should start. Maybe that's why you joined the stream. Maybe this is something telling you inside it's time to start doing something more, investing in your health. You know, health is wealth. Um, and of course, you can work with someone like me, someone like a professional who can tell you exactly what to do to save time, safely enjoy it, and how to put it in your daily life if you have like a busy life, and you know how to start from the point that you are now, what to do to just bit by bit, very gently, very easily, just build up. Okay, this is a bit of a journey, not like a smack bang 6 weeks destroy your body, nothing like that. How Just educate you about how to use exercise, nutrition, and other strategies, fasting, lifestyle changes to manage your side effects from prostate cancer treatments, medications, and also how to use it to fight prostate cancer. But how to do it in a way that is sustainable, that is gentle, and it's a lifelong journey. All right, we're not here for a few weeks, months, and we destroy our body. We hate exercise. We learn how to enjoy exercise, how to love exercise, how to do it safely and gently without suffering. Good technique, not feeling any pain or injuring ourselves. So, how to do that to be able to draw all the beautiful benefits of exercise and just the basically the enjoyment of it, because it is an experience while you exercise. On my stream, sorry, I got a new camera and it's a bit of a uh, weird to, I'm still learning how to use it. So how to, while you exercise, your mind completely empties out, you feel powerful, you feel strong, and you're in control. Okay, and I want to get more men to get to feel that powerful and beautiful feeling of and feeling alive during exercise. um, I've I've personally witnessed a lot of men with prostate cancer that I work with experience that, and I see it in the face how powerful they feel, how good they start feel. Many of them, they have been struggling for years with a lot of mental health issues, because it's very difficult. Sometimes the prostate cancer's journeys can be very, very difficult, lonely, stressful, anxiety. You don't know what's gonna happen. So I've seen a lot of men just get this beautiful feeling of strength, power, vitality, and just hope when they finally get to exercise safely, gently, and in a way that it can be sustained with their current health, current fitness, and lifestyle. So yeah, guys, thank you so much for joining today. It was amazing to have you. I'm actually gonna put this stream on live for anyone who couldn't make it today, if they want to watch it. Thank you so much for joining. Thank you for your questions. Thank you for your inputs and for sharing your experience. I loved talking to you. I loved learning about you. Again, it's 8 a.m. here in Perth, Australia. Actually starting to get really hot in here, so I have to turn on the aircon. But if you wanna talk to me, if you wanna send me a message and just ask me a question, or if you're thinking of just booking an appointment with me, a one-on-one call, or just to work with me, feel free. In the description of the video, I have my website is exerciseelixir.com. You can find my contact info there. I have a contact form. Feel free to drop a message and send me hi. All right. I'm gonna sign off. Thank you so much for today. I love talking to you.